Hi, I'm Christine Inserra, physical therapist since 1982. Today, you're going to get tips on how to climb stairs with less strain. I always say, no one gets an instruction manual with their body, but today you're going to get a chapter on how to do the stairs with less wear and tear on your knees and feet. If you have good knees, great, you'll be working on prevention. If you have troubled knees, it'll be even more important for you to get this right. Tip number 1, safety first. Even if you think you do not need the handrail, a light hand on the railing is your insurance policy against severe injury if you slip. Just make it your good practice. If you don't want to put your hand on a public railing, you can use the inside of your arm on the outside of the railing, just intermittently. Safety second. If you're doing a lot of stairs, try to avoid wearing clogs, flip-flops, slippers, because they can shift and throw you off balance. Doing a lot of stairs, it's best to wear shoes that lace up and have good arch supports, particularly if you're carrying weight. Safety third. On wet stairs, always go more slowly and with more attention. Tip number 2. Stop clomping down the stairs like this. The clomping and pounding is hard on the lower extremity and the back. So instead, you would like to point your foot and toe muscles down to meet the step, then slowly and deliberately lower your heel. Think of yourself as trying to sneak down the stairs quietly, and that should kick in a gentle descent automatically. Watch me. I'll come down slowly, pointing and lowering heel, pointing and lowering heel, pointing and lowering heel, pointing and lowering heel. I'll do it fast for you. Once this becomes automatic and you've got it, you can pick up a little speed. Third tip, don't run up the stairs if you're 40 or older. I had a patient who damaged his knees, running up the elevated stairs every day to work like he was in Olympic training, thinking he was doing something good, but he wasn't. This is especially important in cold weather because our joint lubricant does not work as effectively. Tip number 4, and possibly the most important thing to get right, is the relationship between the arched foot and the knee. When this is not ideal, you get all kinds of strain on the inside of the knee, the meniscus, and the kneecap. And this is true whether you're standing, whether you're squatting, bending, or climbing stairs. Let me show you some of the poor alignment of the knee and foot. So we see this harmful alignment very often when people are going to sit down or stand up. Watch me. The knees come to the inside of the foot and the weight goes through the arch. Then people stand up and the knees are still not over the feet. Same thing when people bend down to pick something up. This knee is moving inside of the foot and straining this entire side. Same thing coming down the stairs. People will come down and the knee will come to the inside of the foot, or they go up the stairs. And when straightening the knee is on the inside of the foot. So, let me show you on the skeleton why this is so harmful. All right, so I mentioned earlier that wearing good shoes with support is helpful because we want the arch to be at its maximum height of support. Then the shin is over that arch, and the knee is over the foot and the arch. And that way, the weight is borne most evenly through the foot. Now, when the knee comes to the inside, you can see how the arch is going to flatten. There's going to be a slight gapping here, which strains the ligaments in the knee. It can also cause problems with the meniscus, the discs. And here's another point that most people don't realize. There's a kneecap that rides in this beautiful little groove. And when it rides at a true angle, the weight of the patella, the force of the patella, is not on any of these sides. But when the knee is at an angle, the kneecap will start riding on one facet, on one side, and causing wear and tear. And this is especially important for people who have chondromalacia or wear and tear of the kneecap, that when they bend, sit, and do all types of motions, that the knee should be in proper alignment. So, let's look at good alignment going up and down the stairs. Okay, coming down the stairs, we put the foot down, but watch, this knee is going to be over the foot. Even as I come over it, now this one is going to stay over the foot, even as I bend. Knee is over the foot, knee is over the foot, knee is over the foot. Let me show you going up. Knee over foot, 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 knee over foot. Tip number 5, carrying stuff up and down the stairs. So what if you're carrying a heavy bag of groceries up the stairs? I do not recommend picking it up with one hand and leaning as you go up the stairs. It's hard on the shoulder and it's hard on the back. Instead, what I recommend is to pull it up, grab it underneath with 2 hands, rest it in your belly or pelvis, and try to remain upright rather than bending down, because then you would have heavy weight pulling on your back. So try to hold the weight and take it through your spine and feet as you go up. So ideally, at the checkout, at the grocery, you would have asked your bagger to make light bags for you. But if it is heavy, this is what I suggest. I use the straddle squat, 1 step at a time method. Keep the knees a little bent, your back arched. Pick up the bag, lift. Hold on. Okay, how about a heavy suitcase? You're in New York. You've got to go up and down the subway stairs, or you've got a heavy equipment bag and you've got to drag it up and down the stairs. I suggest 2 methods. First is a repeat of the straddle, 2-handed lift, 1 step at a time method that we just did with the grocery bag. However, I want to remind you that it would be very helpful and supportive of your back if you took an in-breath and exhaled on the pull and firmed your core as you lift. All right, let's do it. I'm going to make a loud breath so you can hear me exhaling. Breathe in. Again, keeping your back arched and your knees a little bent. Breathe in. Now, the other method is the drag up backwards method. Pull the handle up as high as possible. Go up an extra step and lean back with your knees bent and your back arched and just roll up. Again, exhale. There you have it. So how about coming down the stairs with a heavy bag? Again, I avoid leaning away from a heavy bag because it strains the back and the shoulder. I use the shimmy and guide down method. You want to keep your back arched and your knees bent as you shimmy the bag onto the wheels and just guide it down. One more time. Shimmy it forward. Guide it down. Tip number 6, use the half-step method instead of step over step on the stairs. If you've had surgery, an injury, or any pain in your lower extremity, but you must have a good leg or a better leg. Now, I'm going to hold on to the hand railing, ideally if I have a choice on my bad side because I'll have more support. Up with the good, meet it with the bad. Up with the good, meet it with the bad. On the way down, it's going to be the reverse. It's going to be down with the bad, meet it with the good. Down with the bad, meet it with the good. And notice, I didn't have a choice. I could have really used something on my bad side, and next I'm going to show you how to use assistive devices so you'll be absolutely secure. So we're going to start with a standard cane. This is only a light support for balance. If you need to take weight off of this foot, this would not be the device of choice. But whatever device I'm going to show you, the device always starts down. This is my bad leg. We're going to go down with the bad, meet it with the good. Down with the bad, meet it with the good. A reminder, the device is always down, even though we're going to go up with the good. Up with the good, meet it with the bad. The cane stays down. Up with the good, meet it with the bad. So the next level of help is a quad cane on the stairs. This is a large base quad cane with a flat handle. I've turned it this way even though this is technically a little more stable forward, just because the handle part is more stable with the flat part facing me close. So here we go again. Down with the bad, meet it with the good. Device goes down. Down with the bad, meet it with the good. And on this one, I can put a fair amount of weight on my hand to take some weight off of the foot. So you'll see I have the wide part closer to me to lean on. And again, why is it that the cane or the device is always down? Because if you put it up, it is really hard to get enough push on the elbow at that height. So it's always good to come from below. We're going to go up with the good, meet it with the bad. You can see that I can even put a little tiny bit of pressure on here and still use this device. The next device is a crutch. I didn't have the more common underarm crutch that fit me to show you, so I grabbed this Swiss crutch or a Loftstrand crutch. It is much more stable on the stairs than any of the canes. Again, down with the crutch. I'm going to show you that I can even keep all the weight off if I'm strong enough as I come down. Meet it with the good. Down, down with the bad, meet it with the good. That's if I need to keep the weight off the foot. Let's do it going up. crutches down. I'm going up with the good, meet it with the bad. I'm going to try to keep the weight off here. Up with the good, meet it with the bad. So if you use a walker, my first suggestion is to have one on all the levels of your home, if possible. And for sure, if you're using a rolling walker, never use it on the stairs. But if you have a flat-bottomed walker and your balance is fairly good, the walker is a so-so device. You will not be able to take full weight off of your foot, but if you angle it slightly and jam it in the corner a little bit, I could probably do partial weight bearing. Again, down with the bad. And you noticed my little soft touch of the toe and lowering. Down with the bad. Meet it with the good. Here we go up. The walker is down. Up with the good. Meet it with the bad. Up with the good, meet it with the bad. Now, I know I said that the best alignment of the knees for reducing strain is to be straight over the foot, and that is still true. However, there is more strain on the knees when the feet are perpendicular to the stairs, meaning pointing straight ahead at the stair edge. So, if you're having touchy knees, or if you have pain, try going up and down at a slight angle. You can still do the half-step method, or sometimes on the way up you can try the step-over-step method, but this is also very secure because you've got two hands on the handrail. The knee is still over the foot, but it's at a slight angle. Now, I'll show you the step over step. Works better on the way up, though. So these next two tips were given to me by patients who had bad knees. And so if you have painful knees and you have fairly good balance and awareness, you might be able to try these and see if they help you. Now, the first one is called the half-foot method. And why it works is you don't actually straighten your knee the full arc of bending and straightening when you keep half of your foot off the edge of the step. So let me show you. I'm going to go up. And you see, I barely straighten the knee before I'm ready to do the next one. I could even do step over step, but my knees are bent most of the time. That's for going up. Now, the method for going down requires even more awareness, but some people swear by it. You go down backwards. And it doesn't bother the knees. So people ask me, should I do stair climbing as an exercise? And I say this, the longer you can climb stairs throughout your life, the better your balance will be, your thigh strength and buttock strength will be. People who move into a retirement building or a building just with an elevator who are not doing stairs regularly lose strength in their thighs, buttocks, and then with their balance. So the thing is how much to do. If you're a person who goes, oh, let's do 10 flights of stairs and I'll go up and I'll go down, that is probably too much unless you're in Olympic training. Because of this, the body rehydrates the cartilage and repairs it on a daily basis. If you do excessive exercise on the knees, you are likely to wear it down, particularly if you have touchy knees to begin with. So, 2 or 3 flights of stairs intermittently throughout the day is a good thing. Now, if you're recovering from surgery or an injury, you may need to start at a lower level, and I'm going to show you 3 exercises. One is going to be on a stack of books, and it'll be a lateral side step up, 4 inches. I'm going to say that you can progress yourself over time to the actual stair, which would be 7 inches. Mine are 7. I'm going to show you a straightforward step up alternating on the real stairs, and I'm going to show you a isometric alternating lateral step up. So, how to start? I would say start with the 4 inches, see how you do. 5 repetitions, holding each one 5 seconds. Start with 5 repetitions, see how that feels, give it a 20-second break, and maybe try another 5, see if you've got the endurance for that. Over time, you'd like to work yourself towards a complete set of 10 continuously, and then over weeks' time, you would want to be able to do 2 sets of 10. This is one of my favorite exercises. It engages the thigh muscles in an isometric way, but then a releasing way. And if you have the balance to not do it holding on, great. And I just didn't want to have something in front of me. But you're going to pretend on my little 4-inch set of phone books that are taped together securely. You're going to pretend you're in sort of a skiing, downhill skiing mode. And you're going to very slowly touch your foot down, 1, 2, 3, and then return it. Switch your weight, 1, 2, 3. This thigh is working very hard. One more time. This thigh is working very hard. So your knee is always a little bent on the book as you step down, touching lightly. This is the lateral step up using a 4-inch set of phone books that are taped. And it's often necessary to start with a lower step, particularly after surgery or an injury, and work your way up in terms of height. You should have something stable near you, a countertop or a chair, and try not to push on your hand. Again, the knee is lined up over the foot. You don't use this foot to help. Try not to snap the knee back. Have control on the way up and nice slow control on the way down. One more time. 1, 2, 3, 4, 5, and slow control down, keeping the knee over the foot. Side step up on an 8-inch stair. Don't use your hand to pull yourself up. Have the knee over the foot. Try not to use this bottom foot to help. Here we go. Up. 1, 2, 3, 4, 5, and down. Show you one more time. Try not to snap the knee back. Have control. 1, 2, 3, 4, 5. And have control on the way up and down. This is alternating step-ups. I like to start with the right leg, then go up with the left, then go down with the right, down with the left, and then switch so that the legs don't get fatigued. This is on an 8-inch step. If you need to, you can look down, but if you don't need to look down, it's better to be more erect. Here we go. Right, left, right, left. Left, right, left, right. Some final thoughts on fine-tuning your stair climbing. There are times when my legs feel a little tired, and it's harder for me to get my leg up and my foot onto the step. And so what I do is I use more of my whole body. There are 2 techniques. The first one involves me using the muscles of my waist to hike my whole pelvis up, which helps lift my leg and foot. I'll show you. Hiking. The second one involves using the rotation of my upper body. And I only do that if I'm on a stair set that is safe and I can let go of the handrail. Watch me. A parting thought. I've observed that it's very easy to start bending forward when you're going up the stairs, and that interferes with your full breath mechanism. So observe yourself. See if you aren't starting to lean forward when you're going up the stairs, and if you are, use your hand on the rail, straighten your arm, and remind yourself to go up more erect. So there you have it. Stair climbing with less strain. If you found this video helpful, subscribe, like, share, leave comments, and till next time,